All right, you're good to go.
Thank you, Dominic. Thank you, everyone, for tuning in tonight for a live COVID-19 Town Hall local updates with your Tompkins County officials and guests. My name is Shannon Alvord. I am the Tompkins County Health Department Public Health Communications Coordinator. We are joined tonight by our Public Health Director, Frank Krupa, Rachel Buckwalter, who is the Senior Community Health Nurse at Tompkins County Health Department, and a very familiar face to those of you who have been through one of our clinics. And we're also joined tonight by our guest, Dr. Snedeker, a longtime pediatrician from Northeast Pediatrics, newly retired, but retained as an infectious disease consultant. So we're really glad to have you joining us tonight to talk a little bit more in detail about COVID-19 vaccine and the newly announced ability to vaccinate youth ages 5 and up. So thank you all for joining us, and we'll get started. This is a very exciting phase to our pandemic response. We're really glad to have reached this pinnacle moment. And so tonight we'll have our speakers share a little bit about what that means so far for our community, as well as give a general update on COVID-19 disease prevalence. So, Frank, before we dive into talking about the vaccine approval for children ages 5 to 11, will you give us a little bit of an update since the last time we did one of these meetings on the current disease prevalence, hospitalization rates, those sorts of questions that we're always asking?
Thanks, Shannon, and thanks to Rachel and Dr. Snedeker for joining us for this town hall. Yeah, things are heading in a good direction. We've really started to shift our focus over the last few months to severity of illness in our community and looking at our hospitalization numbers, and they have remained steadily low, which is really, really good news. And I think it's reflective of the significant vaccination status in our community. So that's really good news. Our numbers have been trending, case numbers have been trending in the right direction. We actually shifted last week from high transmission to substantial transmission on the CDC's data tracker, which means, again, we're heading in the right direction. It's important to note those numbers, the case numbers, are going to fluctuate. In the last couple of days, we've seen some bigger days than we've seen in a while, but we know that's going to happen, particularly as we go here now through leaving fall into winter and hit flu season, and generally when we start to see more respiratory illness. And we do expect our case counts are going to fluctuate. We're going to have holidays coming up with gatherings, travel. All those things are going to impact our case numbers, but really what we want folks to be focused on is that severity of illness, right? Making sure that folks aren't ending up in the hospital, and that if they are getting COVID, we hope nobody does, but if they do, it's a mild case, they're able to recover quickly and get back to their daily lives.
Great, thanks, Frank. You spoke a little bit to this, but is there anything else you'd like to share about, as we move into the winter months and the holiday season? The mask advisory is still in effect for Tompkins County. Any other precautions to take? Yeah,
we do still have our mask advisory, asking everyone when they're indoors to around in public to be masked. I think we're talking about the holiday seasons and kind of how that might impact disease. We know that our behavior changes during the holidays, right? We're together with more people, particularly family and friends, to celebrate the holidays. And there's more opportunity for that longer term indoor close contact, which tends to be the route of transmission. So, we'd encourage folks to continue to wear those masks while they're indoors. We're not saying don't have your holiday events, but we want to be mindful about it. And particularly for those with underlying health conditions, it's still really important that we as an individual think about our own situation, whether we might be a senior in our community and or somebody that has underlying health conditions. you might have to take some additional precautions during the holiday seasons, and perhaps limit the number of people that you're around at some of those family gatherings. But we encourage people to start to get back to normal, but to think about their own risk and try to follow the guidance as we've got it out there. And hopefully we'll have a safe holiday season for everyone.
Thank you. Okay, Dr. Snedeker, we have a number of questions about the COVID-19 vaccine and the studies that were conducted on this age group from youth ages 5 through 11. Would you mind giving us a little bit of context for those studies that were conducted and how it was determined that the vaccine with Pfizer was safe and has efficacy for this age group?
Sure. So the Pfizer vaccine studies began about 6 months ago, and they included about 2,200 children roughly. And of those, 2/3 of them got the vaccine and 1/3 got a placebo or a dummy shot, so that they could compare side effects of the real deal versus a placebo. And then those children have been followed. Some of them have been followed for as long as 6 months. The follow-up interval for some is shorter if they got their vaccine later in the course of the study, but all of the children are at least 2 months out from when they got the vaccine, when that data was reported to the FDA. And what it showed was that basically 99.9% of the children who got the vaccine had good antibody titers, antibodies in their bloodstream that should be enough to protect them against serious COVID illness, in theory at least. And what it also showed is that they followed those children to see if they actually got COVID, and a small number did. And what was significant was that a lot more kids in the placebo group got COVID compared to kids who had been vaccinated. So that the vaccine was about 90% effective in preventing kids from getting sick from COVID. None of the kids in either group were seriously ill, were hospitalized, nobody died, nobody had major complications. It was a very small number of kids that got COVID, but because of the number of kids in the study, it was enough to prove that the vaccine was effective. Side effects from the vaccine were the usual ones that one expects with any vaccine. For the most part, it was arm soreness, low-grade fever, headache, fatigue, things like that, which were typically brief and relatively mild. There were no serious adverse events that were believed to be due to the vaccine, and none in the placebo group either. And there were no cases of myocarditis, which I know is on everybody's radar screen as a potential vaccine complication. So of the roughly 1,500 kids or so who got vaccine, none developed myocarditis afterwards, but that's a rare enough complication that one wouldn't have expected to see any cases of myocarditis unless the rate were much, much higher than was anticipated.
Great. And for parents who are preparing to get their child vaccinated, what are measures that we could take to mitigate some of those side effects? Is it okay to use Tylenol post-vaccination? Sometimes you hear that that's not recommended.
It's perfectly okay if it's needed, but we don't generally recommend that parents pre-dose their kids with medications like that, expecting that there are going to be side effects. Most kids don't need any medication to relieve the mild discomfort of the vaccine afterward, but if their discomfort is enough to be bothersome, it is perfectly okay for them to take a pain reliever or a fever reducer if they need to. And typically, though, if those side effects occur, they're usually within 2 or 3 days of vaccination, most commonly the next day, of course.
Okay, thank you. Is this vaccine different from the Pfizer vaccines that youth ages 12 and up have received?
It's the same vaccine, except that the dose is lower. So the amount of the active ingredient in the vaccine that teens and adults are given is 30 micrograms, a very tiny amount of the messenger RNA that is the good stuff in the vaccine, if you like. The dose that was studied in the younger children was a 10 microgram dose, and they selected that dose based on a pilot study of a small number of children testing different doses to see what might be the best dose in younger kids, not necessarily assuming it would be the same as adults. And it turned out that that smaller dose was equally effective, and the antibody response that those kids got was just as good as teenagers and adults who've gotten the larger dose.
Okay, couple more vaccine questions here while I've got you in the hot seat. So do we know anything, have any of the studies shown if the vaccine is proving to protect against the variants that we've seen locally?
Absolutely, because it's not just a local thing. And in fact, all of the disease that we see locally and that most of the country is seeing now is the Delta variant. And so the kids in this study, when they had breakthrough cases, whether they were in the placebo group or the vaccine group, that was Delta variant. So we know that the 90% effectiveness against symptoms applies to the Delta variant.
Great, that's really encouraging to hear. Okay. How about any special precautions or guidance for immunocompromised children? Is the vaccine safe and effective for those children who may have special needs?
As far as we know, it is. About 20% of the kids in the vaccine study actually had risk factors for more severe COVID illness. But most of those were things like obesity, asthma, which is listed as a risk factor, although it's really only uncontrolled asthma that is. I don't know the exact breakdown of how many kids in the study were considered to be immune compromised, but it's logical to assume that, you know, if there were over 2,000 kids and 20% of them had some risk factor, there probably were some kids in there that would be considered immune compromised. As far as we know, the vaccine is reasonably effective in immune compromised people, in adults and in adolescents. It is not as good as if you're not immune compromised, but it's still quite good. The efficacy is still well worth getting the vaccine, even if the effectiveness is slightly reduced.
Do we know if there are studies being done for even younger children, ages 2 and up, or even younger than that?
Yes, there are, both for the Pfizer vaccine and the Moderna vaccine. They are both studying children 6 months and older. The breakdown is a little bit different for the two companies, but they're both looking at kids under 5 as well. And I won't go into the details about dose and things like that, but those studies have been initiated. They're not quite completed yet because the numbers of enrollees in that has been a little bit smaller than in the older kids as of yet. The amount that they intend to enroll is the same. And so as soon as those are completed, then that data will be submitted to the FDA. We don't have any preliminary results about that age group yet.
Okay, great. And Frank, you can feel free to chime in if you have a response to this question. Is this vaccine still considered an emergency authorization? Will it be required for schools?
So yes, it is being approved under emergency use authorization. As far as the requirement for schools, ultimately that is a decision that's made at the New York State Department of Health. And so we obviously will have to wait and see. It's not required now. And I don't imagine in this first wave of administration of vaccine, it will be. Likely wanting to move to full approval before that goes into place, and certainly would want to have more than one brand of vaccine available for that age group. So whether or not it will come is ultimately not a local decision, but I think we're still a bit off before that might be considered.
And it's worth pointing out that the use of the vaccine in kids over 12 is still under emergency use authorization as well. Full approval for the Pfizer vaccine applies only to those 16 and older, and 18 and older for the Moderna vaccine.
Gotcha. Thank you. Okay. we see a lot of comments coming through from some concerned parents out there. And the question is really, I thought children weren't really getting sick from COVID. Is COVID really a concern? Why should I let my child get this experimental vaccine?
Well, I can address those. So it is true that children are less likely to become significantly ill with COVID than adults. It is not true, however, that kids are not becoming ill and being hospitalized. Somewhere in the vicinity of 2 million kids in this 5 to 12 year age range have had COVID so far. Of those, 94 have been reported to have died, and over 8,000 have been hospitalized. And about a third of the hospitalized kids have required ICU care. So this is not a benign illness. This is an illness that, even though most kids come through it okay, a fairly significant number do not. There are potentially serious complications of COVID, including the multi-inflammatory disorder, or MISC. And there have been roughly 2,300 or so cases reported of that so far. In comparison to other viral diseases that we vaccinate, those numbers are significantly higher. So when we compare that to other things that we vaccinate for, like, for example, meningitis and hepatitis A and some of the other vaccine preventable diseases, the number of deaths from COVID are quite a bit more than that. So we definitely believe that children benefit from this vaccine, and that the reason to vaccinate your kid is to give them the best opportunity to come through the illness safely. It, of course, benefits the entire community if children are vaccinated, because we all know that children can be vectors for all sorts of infectious diseases, and it is a component of the overall plan to make sure that the entire population is protected as best we can against COVID. It's important for kids to be part of that equation as well. And really the bottom line for concerned parents is that, the risk of complications from COVID far exceeds any risk from the vaccine itself. I think many parents have the mistaken idea that somehow they can prevent their kid from getting COVID ever. And I think it's important, in thinking about the risk benefit of vaccinating versus not vaccinating, that it is inevitable that every child is going to get COVID at some point. It's just a matter of when. And we hope that it's later, and we hope that everybody gets vaccinated before they get COVID, so they have the best chance of coming through without complications or without bad things happening to them or their family.
Okay, we have a question that just came in for you, Dr. Snedeker. Why is there not a vaccine titer given before giving a booster? Doesn't it make sense to only booster those that have a low titer?
No, that isn't really how vaccines work. Your immune system works best when it has repeated exposure to something. And with a single dose of vaccine, you might get a boost in antibodies that would be very strong, but very brief. It wouldn't be sustained. And with most vaccines, the best way to get a sustained antibody response is to give an initial dose and then to give another dose later on. And most parents will know when their kids come in for vaccines that most kids get the same vaccine more than once for exactly that reason. Now, once you've had 2 doses, we don't know how long these children will be protected, because they're still within 6 months of getting their first dose of vaccine. So they'll need to be followed just like the rest of the population. We know that in the rest of the population, some people preserve very good vaccine antibody titers for a long time, but in some people it declines. And that's why boosters have recently been advised for elderly individuals, for immune-compromised individuals, and for people with other risk factors, to make sure that they're maintaining good antibody titers.
Thank you. What are the recommendations for exclusion from childcare with the cold season upon us, along with COVID and along with flu? I'll add in.
COVID and flu and RSV and all of the other cold viruses that normally happen. So, really not that much has changed with regard to whether you should send your kid to school or daycare if they're sick. We have never advised that parents do that. We generally recommend that, rather than hoping that your daycare provider will be your child's nurse, that you take care of them until they're better, and then allow them to return. And, with daycare and with schools, there is a balance that has to be struck between kids attending school and being exposed to illness. There's no way to do one without the other. So what we try and do is apply common sense and keep kids home if they are potentially contagious to others, so that everybody isn't sick all the time, not just with COVID, but with flu and with other respiratory viruses and things like that. If your kid has had their cold and they're down to a sniffle and a minimal cough and they're feeling a lot better, they're okay to go back. And that's true whether it's COVID or flu or strep or any of the other illnesses that kids may encounter in school.
Awesome. Well, this makes me think of a question that was on our list a little further down. So I'm going to pull it up now because it seems relevant. And Frank, this might be a good one for you. Will being vaccinated against COVID reduce my child's need to quarantine from known exposure? Will there be less missed school time if with vaccination?
Yes, yes, absolutely. We've this school year, we've made a concerted effort to limit the need for students to be excluded from school. We've seen minimal to no transmission in school settings, but following CDC guidance, we've really, the students really have to be close within 3 feet for extended periods of time before they would be considered a contact. If a child is fully vaccinated, meaning 2 weeks post their second dose of the Pfizer, even if they were within that window, they would not need to be quarantined anymore. So there is an absolute benefit just from a school attendance perspective for having children fully vaccinated. So we definitely encourage parents to seek out a vaccine as soon as they can.
I think that's definitely one of my higher motivators for getting my child vaccinated as well. Awesome. Okay. All right. Let's talk a little bit about the vaccine clinics. Rachel, Frank, how did the clinics go this past weekend? How many children were vaccinated?
So we planned to vaccinate 600 kids each day, Friday and Saturday, and I think we just about hit that exactly. Frank, you probably know the exact numbers a little better than me. It was like 602 one day or 603 or something like that. So yeah, we opened up slots and they filled very quickly. So we know the demand is there in the community for people wanting to get their children vaccinated. I think the clinics went really well. We pulled together a real community effort with the health department, pediatric offices, some community partners that provided things like free books and coloring pages and sensory toys, and it was a good time.
Sorry, I was still muted. Okay. What can we do to help children with any fears or anxieties about getting shots? How is that managed at the large clinic?
Sure. Yeah, well, I think a lot of the preparation starts obviously with the parent when you book the appointment. I mean, for me as a parent, I don't tell my kids like a week before they're going to get a shot. I tell them maybe the day before. We've made this appointment. We're going to get you vaccinated tomorrow, and here's why we're going to do it. It's going to protect you, and it's going to protect your family and your community. When I explain things to my kids, I usually say this is a parent choice, and this is a kid choice. So I make it clear that, in this realm, this was a parent choice to get back for you to get vaccinated, and this is why. And then I just give a little basic, it might be a little pinch, a little poke. It's going to be over with quickly. So that's the preparation leading into the clinic, I guess. And then when you get there as a parent, We have a nice waiting area with a storyboard set up, some really nice pictures hanging in the waiting area. As you move through the clinic, there's the vaccine stations. At each station, we have stickers ready for the kids after they've been vaccinated, fun Band-Aids. The staff that are vaccinating have all been trained in pediatric ways of helping to manage kids' anxiety. The real big ones are comfort from a parent. So, a child seated on their parent's lap, there's comforting ways for parents to hold children to help them feel safe and supported when they're upset. We also can coach kids in some deep breathing to help them relax, maybe pretend to blow out candles on a cake or something to, so your body relaxes a little bit more. And then once the vaccine is over, we have a nice observation area where children will be waiting for 15 minutes following vaccination. We have free books and coloring pages in that area and Disney music playing. So it's a pretty fun and I think welcoming environment for kids.
Great.
That's
Dr.
great.
Snedeker,
And
do you have something to add? Go ahead.
yeah, I'd add that first of all, I support everything that Rachel said 100%. And it's important, I think, never to lie to your kids about what's going on. Be straight, keep it simple, keep it at their age level. You don't have to go into a big song and dance about a lot of those things. And the bit about it being a parental decision is really important. And the other thing is that distraction is really, really useful. So, keep talking to your child through the whole thing. You can sing to them, you can bring things for them to do that can occupy them while they're waiting, and in some cases, even while they're getting the shot. I'm not a big personal fan of little video devices that kids get immersed in all through the day, but on an occasion like this, having something for them to look at that draws their attention is a great way to distract them from what's going on, and that can be really, really helpful.
Yeah, and I would just jump in too, Shannon, having been there through the 2 days and being a parent as well that brought their child through. It's hard when your child is crying, in some instances screaming, trying to run away. And that can be hard as a parent, just to deal with yourself. What I would share is that every single child, even the ones that were the most scared and having the largest reactions, once it was done, almost to a kid, they said, that's it. Or within seconds, they were fine, right? The nurse would slap a Band-Aid on, and as Rachel said, we have some cute Band-Aids, and they'd be off looking to pick out their book. And so as a parent, just know it may be difficult in that moment, but you've made this choice for your child. It's an important decision. We have skilled staff there that will help through the process. And once we get the child vaccinated, again, they'll be back to their normal selves almost instantaneously once it's done. So it'll be difficult for a little bit, but know that it'll be worth it in the end.
And that's the teachable moment for the second dose, because you sort of cement in so that you can remind them when the need for that second dose comes around, how quickly the first dose was over with and how minimal it really was in the final analysis.
That's a good point, Dr. Snedeker, because usually there's a window of time, maybe a year between shots for kids. And so they'll have a little more active memory about that last shot moving into their second dose. All right. Well, thank you all for that great description of the clinic site. Do we know when the next vaccine clinic will be? What are the plans for administering locally?
Yes, so our plan right now is to do the same thing this week that we did last week, to have a Friday clinic and a Saturday clinic. Our hope is to increase the number of appointments available. All of this is dependent on vaccine supply. So we have ordered vaccine. Our hope is to do as many as 1,600 appointments over those 2 days. So up from 600 a day to 800 a day. We have the capacity The issue is vaccine supply. And I don't want folks to think that there's not enough vaccine to go around. There certainly is, but as Dr. Snedeker pointed out, it is a lower dose for the younger children. And so it's being packaged differently. And really that packaging is different because the main impetus of administering the vaccine through the state and federal plans or through pediatric offices. And in an effort to limit wastage of doses, we want to have smaller vials. So that way, if a pediatric office can only get to 4 or 5 kids in a day, they're not wasting the other half of a 10-dose a potential 10-dose vial. So we're hoping that the vaccine will arrive, and we're planning for it. We've become really good at scavenging for vaccine over the last 6 months or so. We have a lot of connections in our region. So even if our delivery isn't as large as we would hope it would be, we're going to try our best to find enough vaccine so we can get those 1,800 appointments done over this next coming weekend. Or 1,600 appointments, I'm sorry.
And there have been some questions about how to get to the mall site if they don't have a personal vehicle. So I will just throw out there that TCAT is still running their promotion that you can ride free of charge to and from any vaccine clinic in Tompkins County. So you go on their website, tcatbus.com/bus-schedules. And we could put that into the YouTube chat as well. So to ride for free, riders are asked to download, save, or print notice of their appointment confirmation from the vaccine provider, and then they can show that notice on their phone or by printing it and show that to the TCAT driver when boarding. So if you need support getting to the mall clinic site, that is an option for families. Where else could children get vaccinated at this time?
Sure, thanks for that question, Shannon. Let me jump back to our clinics for a minute and talk a little bit more about some of the logistics and why we're doing it the way we're doing it, and then I'll definitely answer that question for you. So as we've known through public health and our preparedness planning, when we talk about medical countermeasures, which is just a fancy word for vaccines or medication that's being provided in an emergent event to our entire population, the quickest and most efficient way to get the most people is through large scale events. Right. So that's how we did it with the adults. You'll remember in partnership with Cuyahoga Health Systems, the mall was a mass clinic where thousands of people a week were able to get access to the vaccine. So we start there, which is what we're doing with the children. As I said, we did 1,200 this week. We're hoping to do 1,600 next week. That's about 50% of the 5 to 11-year-olds in our community. So we'll have put a significant dent in the population. And then we go out and we look at where there are gaps in our community, where there are populations that we haven't reached. And then we take it to the smaller scale level and try to reach those populations. So that's the same planning that we have going on this time as we've done with the adults. Dr. Snedeker mentioned, we do believe that eventually all of us are going to be impacted by COVID one way or another. And so it's important for us to get as many people vaccinated as quickly as possible. So when they do encounter COVID, they will have as much protection as possible. So that's the process and the plan that we've put in place. Our registration links, we're not putting them on our website. We're doing it similarly to when we had the registry. If folks will remember back when we were doing the adults, we asked folks to register and then we would send those people links. So everyone wasn't clicking all the time trying to find an appointment. It would go directly to those people that had registered by priority group. This time around, we're using our school districts and our pediatric offices. And the reason for that, to be quite honest, is not every county is taking this approach. You've probably heard both the governor and the president talking about pediatric offices and making an appointment with your pediatrician. And that's great. They're an awesome resource. And we're going to encourage people to reach out to their pediatricians as well. But they have a lot of other work to do. There's sick children, there's well visits that need to happen, there's visits that need to occur so kids can get back into school. And to put large amounts of vaccinations where that's the only reason the child would be coming into a pediatric practice, it will take time to do large numbers of children. So what we want to focus on and what we're trying to prioritize here are children that live or go to school in Tompkins County or have chosen to make Tompkins County their medical home. So we've used our local school districts and the pediatric practices that are partnering with us and helping staff the clinics. And we appreciate them so much, Northeast Pediatrics, Wellbeing Pediatrics, for providing vaccinators at the clinic. That's how we're getting the links out, because we want to make sure we prioritize the children in our community here in the early days. I imagine at some point in the future, depending on how uptake goes, there may be some more public links that are available. But right now, that's the route that we're going to prioritize our local children. So to answer your question about where other places that folks can go, I would encourage folks to talk to their pediatricians or their family practice, their healthcare provider, where their children are seen regularly. I'm sure, particularly once we get through these large clinics, that our pediatric offices will begin to offer those one-off appointments to be able to vaccinate the children. If your child has some special needs and you don't think coming to the mall in that kind of larger scale setting will work for them, I would encourage you to talk to your healthcare provider and go through that with them. Many of them have helped us at the clinic, so they know what it looks like and might be able to share their thoughts about the appropriateness. But more importantly, they'll probably be able to give you an appointment at some point to see your child in their office if you think that's the more appropriate setting. That may be into the future a bit because they're using a lot of resources to help us at the mall right now, but it certainly will come and be an opportunity. And we also know that local pharmacies are beginning to do some children. Not all pharmacies, so I would encourage you to call ahead and make sure that they are doing children and have the vaccine available. But that's an alternative for folks that they can seek out as well. So there's different places, and as I said, once we get through these large scale clinics, we hope that we'll be able to look at where the gaps are in our community and begin to provide the vaccine where those gaps are as well.
Great. Thank you for that overview, Frank. If I have concerns or questions about the vaccine, who could I speak with? What resources are there? What would you direct me to find more information? Pediatricians' offices?
Yeah. There's a lot of information on our website for folks to take a look at. But we always encourage people to talk to their healthcare provider, because each of us is different. We're unique in our health, and our primary care provider, whether it be a pediatrician, family practice, or the such, they have the best knowledge about our overall health. And they would be in the best position to kind of answer those very personal questions. Certainly the health department is a resource, but we don't know you. We don't know anything about your health history. And, the questions that you're asking are probably going to be way beyond what we would be able to answer just because we don't have that background knowledge. So we always encourage people, whether it be adults or adults for their children, reach out to your healthcare provider if you have questions, because they're going to be the best ones to know you and answer your questions as specifically as possible.
Great. So when we were encouraging adults to get vaccinated, and we still are, the New York State released policy that you could receive time off of work to be vaccinated. Will the same thing count for schools? Will that be an excused absence to miss school for vaccination?
I would hope so. I don't know definitively the answer to that, but having spent as much time with superintendents and other school staff, they are very excited about the opportunity to have the children vaccinated, because it's one more giant step towards getting back to normalcy in those school settings. And that's what we all want. So I can't say definitively, but I would imagine that being away from school to get vaccinated would be excused.
Okay. This is kind of another school setting question. Will masks continue to be a requirement in public schools and other settings once children are widely vaccinated?
Yeah, it's a good question. And I had the opportunity to have a conversation with a mom at the clinic, I think on Saturday when she came through, and she had a lot of really good questions. And this was one of them. You know, she said she was supportive of vaccination. She had her child there getting vaccinated. She was supportive of the steps that were being taken to prevent and limit the spread in our communities, including masking in schools. But she was honest and said she's tired and her children are tired, and they're concerned about when do we get back to normal. And I completely understand that. And I'm the public health director on this call, but I'm also a community member. I have a family, I have a young child. So we're dealing with those same issues. And I know everyone wants to know when we're getting back to normal. And what I can say is that getting this group vaccinated is a giant step forward, right? Every bit of our population that has access to vaccine that can help us get that protection for them is a giant step forward. So first, I would encourage parents to definitely get their children vaccinated. As far as masks in schools, that's not a local decision. That decision is made at the state level. It's a mandate from the governor to the school districts to have masks in schools. So I don't get to make that decision here locally. What I can say is that we've been taking measured steps since the summer here to begin to roll back many of the public health interventions that had been in place, right? I think at this point, really what we have out there now is our recommendation around mask wearing indoors, because we still have substantial transmission in our community. But we are encouraging people to go do the things that they like to do, hopefully as normal a fashion as possible. When indoors, wear a mask. I know it can be inconvenient. We're tired of wearing them, but it's a small ask from my perspective. I know others might disagree with that, but it's one thing we're still asking folks to do. And I think as we progress and we get more and more people vaccinated, including the children, we're going to be able to go even further with those. Certainly, as I said, here in Tompkins County, we've been trying to be reasonable because we know people are tired. And quite frankly, compliance isn't the same that it was even this time last year, right? Folks are tired, and it's harder to see the benefit of the things we're asking them to do. It doesn't mean they're not important, and they are, and we wouldn't be asking if they weren't, but we also have to measure that against what people are willing and able to do as we move forward. So there is light at the end of the tunnel. And again, getting these kids vaccinated is a huge piece of that. It's why we're putting so much energy and effort towards trying to do it so quickly, to get those kids protected first and foremost, but also to try to get more normalcy as much as we can. Again, ultimately, the mask decision in schools will come from the state level. But I think here locally, we've tried to be consistent and measured in our approach and the things that we're asking folks to do as the disease has evolved. So hang in there, everyone. We're getting there. Let's get the kids vaccinated, get over this hump, get over the holiday season, see what things look like on the flip side in January and February. And hopefully we'll be having conversations about us being pretty close back to normal as we can be.
Thank you, Frank. That sort of led straight into my final question for tonight. We aren't seeing any other questions coming in through the chat. So this is to all three of you panelists. What are your hopes for the fall leading into 2022?
Well, I guess I would say my hope is that people will continue to be somewhat vigilant, but not be fearful. as much as has been the case in the past. We've come such a long way from where we were a year ago at this time, now with a substantial proportion of the population vaccinated and with case numbers declining. COVID is not going away, and the concept of getting back to normal, I think, is going to be a little bit different. Always after this. Doesn't necessarily mean that we will still be masking a year from now. My crystal ball is fuzzy in that regard. But I think we're in a much better place, and we can treat COVID with respect without being terrified of it in the way that we were a year ago when we had very little defense against it. So I'm grateful for the progress that's been made. I hope that progress continues. I hope that everybody takes advantage of the tremendous opportunity to be vaccinated and be as well protected as they can be.
Right,
So,
Rachel?
Oh, I would just echo, I agree. I would like to see COVID sort of like the common cold, maybe. I would like to see people not dying from COVID any longer, but it perhaps might circulate at low levels. But that we could return to a little more of a sense of normalcy with gatherings and with school and all of that.
Yeah, and certainly agree with all of that. I think my biggest hope is not only that we, come out the other side of the emergency, knowing, as Dr. Snedeker said, that COVID is with us to stay. But on the flip side of this, we learned a lot, and people learned a lot about public health in the last couple of years. And my hope is that we benefit from that long term, not just from COVID, but from all of the other infectious diseases that we have to deal with. And if you'll remember back January, February, March of 2020, our initial message was, stay home if you're sick, cover your cough, and wash your hands often, right? That wasn't a COVID thing. We've been saying that in public health for decades, right? Because we know those basic steps can help us. And to be quite honest, if we all are, if we're all honest with ourselves, how many times did we go to work not feeling quite right? Right? We might have had a small cough or a little malaise, or we were congested, right? And now we stay home when that happens. At least I hope we are, right? Because we've learned that the long-term impacts of that are worse than, missing a day of school or work in order to recover. And hand washing and covering our coughs. We talk about mask wearings and all the conversations about masks. We've been talking about covering our coughs for these very reasons. It's not perfect, but it's better to cough or sneeze into your elbow than the opposite, right? I mean, if you're standing close to somebody and they sneeze, you sure hope that they covered their nose when they did it. So that's my hope. My hope is, we can move through this emergent phase. We can, learn to understand what living with COVID looks like. And that, again, as Rachel said, we're not seeing people dying from COVID, and that we can get back to, some level of normalcy, implementing those basic public health interventions so we don't need the more significant ones.
That's a terrific point, Frank. And it aligns with what I said about things being different going forward. And I didn't necessarily mean in a bad way. I mean that we're more conscious about how effective those basic measures can be. When we think back to last winter, when people were attentive to masking and hand washing and distancing and staying home when they were sick, we saw no flu. We saw very little strep. We saw, all of those things that we expect waves of every winter just didn't happen. So we have tremendous power to influence these things if we make thoughtful decisions about them. And I hope that continues to be part of the public conversation as we move forward.
Well put. Thank you. And thank you all for tuning in tonight. And thank you to our audience members for the really great questions. We'll continue to keep you posted as we navigate through this. And at each new turn, the health department is here for you to provide guidance and offer support. So,
I would just add, if I can jump in, Shannon, I know we're wrapping
ahead.
up, but our health department has been such a tremendous resource. We've been extraordinarily fortunate locally. And while I know that health departments all over the country have really stepped up during the pandemic, I think ours has really been special. And I want to acknowledge that.
Thanks, Dr. Snedeker. All right, everyone, have a wonderful evening and stay well.